We're gonna do a reaction video to Man Fixes Embarrassing Botched Hair Transplant from the Hair Loss Clinic. This is a TLC show. Let's go.
My name is Pierre. I'm 32 years old.
Yes, he said he's 32. I would say the average age of patients who come in for hair transplant is about in their mid-30s.
Eventually I did end up choosing to go to Turkey. I knew instantly once the transplant was complete and I saw myself in the mirror the next day, it was not right.
It's good to show people what you're doing as you're working, in my experience. So I like to show patients what's going on with the transplant as the day goes on.
I'd gone for the second one. I went, going in the UK. No matter how much research I'd done, thinking I'd made the right decision, and then to find out immediately afterwards, it was just terrible.
Well, this is one of those things where I think the patient ought to be intricately involved with the planning stages of a hair transplant, and that includes markings. So I don't know if they showed him markings and he approved them and then they went outside of those borders or those markings, or if they didn't show him at all and just said, like, trust us, or he may have approved the lower hairline and then realized later that it was not what he wanted.
That's when I went into SMP. It's just little.
So SMP, as you guys know, we have a whole video out on that.
I understand you've had a really rough time with your hair.
I've had 2 transplants now.
I'm guessing you don't go out in public without your cap very much?
No. At work as well as
Is that ever since the transplant?
Yeah, now it's more embarrassing for the result of the transplant than it is.
You know, immediate reaction, at least from the side view, I'm not seeing anything that's really grossly abnormal.
What about the actual shape of the hairline?
I think it's quite low. The first transplant was supposed to be higher than it was, and they did put it lower, and the second one had to be lower.
Yeah, I mean, I can see why, you know, he finds that it's a little bit low on one hand. On the other hand, you know, the hairline's not going straight across, which is good. It has some natural recession. When I look at his horizontal thirds, they're not way off. It definitely is not exactly where I would have placed the hairline, but it's not terribly low.
It's the shape that bothers him. It looks harsh, it looks unnatural. And they've started something which is now thinned behind it, which looks all out of balance.
The directionality of the hairs looks a bit off, but as far as his overall density, it doesn't look too bad.
It could look a lot worse. He's hiding it really well.
I agree with Dr. Ball, is it?
The micropigmentation, so he's got ink in there, which makes it look like he's not losing as much hair as he really is. So actually he's done a good job of hiding it.
What I'm seeing is that maybe the frontal hairs are not as irregular as they could be. They're standing up a little bit too much. Maybe some of them are a little bit denser hairs, like the 2 and 3 hair grafts instead of just being all singles.
At the moment, your forehead distance here is smaller than the tip of your nose to your chin, and that's unusual.
There are different ways to look at this as far as the proportions of the face, and yes, there's the idea of the horizontal thirds. Not every patient subscribes to that, and not every face needs to have the horizontal thirds be exactly the same. So I can see here basically where he's marked the hairline wanting to push it back. We'll see how he does this. The risk is, of course, as you start to remove some of those grafts that have already been placed there, now you're essentially trading hair for small scars if you do the FUE method.
Normally, this distance is roughly the same as this distance. And so that's where the hairline would sit, like that. Because it needs to look like it's crept up over life and then crept in on itself. Someone has given so little thought and so little regard to someone's well-being that they've just thrown hair in somewhere, a quick fix, off you go, job done, taking your money.
So what he's pointing out here is that sometimes there's a disregard for just basic facial aesthetics. There can be a disregard for trying to do the right thing for the patient instead of just, you know, making a quick buck. And I think that there's a lot of truth to that in the way that people practice hair transplant surgery in certain clinics around the world. But I think one of the other points of consideration is that patients are often shown their markings, you know, the markings that are drawn out for them before the surgery. And I've had situations myself where a patient will actually approve the markings and then later on say, well, you know, I wish it was a little bit different than the way it came out. But, you know, if it followed the original markings that were approved by the patient, then it's kind of hard to go back on that. And, you know, it's not only the surgeon's doing then if markings were approved.
Those grafts can be removed. They can be moved back to a more conventional area to create a more natural hairline. We need to make sure that every hair counts, and so we've got to get it right this time.
Well, what you're saying is spot on to what I wanted to begin with, so I'm actually quite pleased with what you're saying. It's put a bit of hope that It's not too far gone. It can be dealt with.
So it looks like they're planning a hairline repair by removing some of the hairs that are in an area that really is not ideal and pushing them back.
It will hopefully be the end of the journey. You know, it's once all that hair is put where it should be, and it looks natural. I'm hoping that 3 is the limit.
I think after one surgery, we should be able to make a significant improvement that will have him see that he's heading in the right direction. It's not going to be a quick fix. It never is when it's a difficult situation like his.
Something to keep in mind is that it's usually better to just get things right the first time. That's something that oftentimes people forget to consider. They think that they can just keep going back for more surgeries, more corrective procedures, but it gets harder and harder and usually more and more expensive to do these corrective steps later on.
Normally when we're doing a hair transplant, I'm taking hair from the back of the head and I'm transplanting it to wherever the hair loss is. In Pierre's case, these hairs have already been transplanted once, and I'm now having to extract them and move them a second time. So this is going to be a much more tricky process.
Now, this always sounds worse than it is.
Are you okay?
Yeah, it's fine.
We've got a very cool customer.
Oh, actually wasn't bad at all.
Good man. I'm going to just take out a few grafts just to...
So he has these Zeiss loops, which is actually what I use for extractions myself. So we have a similar headgear.
Just relax for a second.
So I think he's using the WA system here by Jean Devroy. You know, I've interviewed him about this device.
I'm going to hear the little clicking noise, which is my little motor that I'm using as I'm dissecting around each of the grafts. And then Ildy's lifting them and popping them into a solution. So they're a little bit tethered, a little bit stuck down because of the scar tissue. Fascinating how...
They go the direction.
so random. This one's going literally backwards.
So he's just commenting on the poor directionality of the way that the hairs were placed or the way that they grew out in the first place. There are times when hair can grow more posterior. Usually hair is directed forward at the hairline for most people, but there are times when directionality changes quite a bit naturally. And so we try with the hair transplant to follow the course of those hairs, and occasionally it can actually be aimed back posteriorly. Again, I wonder how he's going to address this concept of scarring from the FUE extractions right at the hairline.
And this one's going off to the right, that one goes to the left, that one goes backwards. The hairs have been put in a really haphazard fashion. It's really challenging when we're dealing with hair that's been put in so badly. It upsets me because it's just a quick fix for someone in and out of a clinic, and it leads. So we're about halfway through Pierre's surgery, and it's proving slightly more complicated than I was expecting.
Again, the key here is when you're doing FUE, you want to minimize the number of punches that you're making. So if you have, let's say, 100 or 200 grafts, say 200 grafts to remove from each side, you want to ideally make 200 little holes. You don't want to create 500 little holes just to get 200 grafts out, meaning that you want to have high efficiency. In order to do that, you need to be able to, first of all, be good at FUE extractions. And second of all, this stuff takes time. You know, it takes a long time. So even for a smaller procedure that is corrective, it seems like I don't know how long they've been going for, but probably at this point for hours, and they still are not done with even the extraction portion.
To remove these badly placed grafts. I'm not sure any of them are actually growing forwards in the standard correct direction. He's a strong one.
Yeah.
If you guys are enjoying this reaction video to the hair loss clinic and the show that they have on TLC UK, go ahead and start spamming TLC. Let them know that we should also have a show here in the US to be able to do some corrective work, some work for people who may not be able to even fly to Turkey to afford even a cheaper hair transplant. Yeah, let them know that we would also like to have a show.
Got loads out. We've got more grafts out than I was expecting.
Oh, nice.
So although a lot of the hairs that we took out were...
Now the hairs have been removed, but in place of those hairs now there are small little holes, and I'm not sure which punch size he used. My guess is at most probably a 0.9 millimeter punch, maybe even smaller than that. And so he's removed it quite nicely, but there still are holes that are going to lead to scars in a pretty prominent area.
Angled very strangely, going off in lots of different directions. The ones further back seem to be much more conventional. So it shouldn't be too much of a conflict with where we want to be placing them. So the next step is going to be getting the grafts into the back.
I'm seeing a recipient blade holder and a similar type of blade to what I use. So it looks like Dr. Ball and myself actually have very similar technique. It'd be fun to meet him one day. Seems like he really is doing a nice job here. He's making the sites now, and then the grafts are going to get placed into each of these sites.
Start by placing with an implanter, so the graft is fed into this tube.
Okay.
This is interesting because I've done a video on DHI FUE. What Dr. Ball has done is he's made the sites first using a sharp type of instrument called a blade. He then is using the implanter pen that is likely has a dull tip, and he's feeding the grafts into the implanter pen. So this is a form of DHI, but a little bit different. Essentially, he's making the sites first and then placing the grafts using implanter pens. Some people use sharp implanter pens, which is what DHI classically is, and they're using that to then place it into the skin. The alternative, of course, in classic kind of hair transplant work is to use a forceps. All these methods work.
What I'd really like to do is place some soft fine hairs to create the natural hairline that he will then be left with. Can I give you that? So you can see where we've taken the grafts again. So we took a lot of the 2-hair grafts out in the hairline. We also halved, especially down this end, we halved some of the 4-hair grafts. So where you had a big chunky 4-hair graft just in or just behind the hairline, we took 2 of them so that we've created a nice little soft 2-hair graft and moved this 2 back. So that's going to, you've got the benefit of the hair there, but it's just going to look a lot softer.
The point of the hairline work is to really try to have finer hair grafts up in the front few rows, and then fade that back into heavier hairs. But you don't want to go single hair grafts directly into a 4-hair graft. Ideally, you'd go to like a 2 or a 3, and then save the big 4-hair grafts for an area that's much denser, like the forelock.
We can immediately see it now. Now that all that other hair is out, it just supports that newer hairline even more.
Yeah.
It seems more appropriate. I feel more comfortable with it.
Well, he's got to let the hair that's been moved grow, but then he also has to let the little holes that were made heal. So that's going to be the other tricky element here, is to see how Pierre heals as far as all those little FUE scars that were made. As far as those scars, what can he do if he has scarring that he doesn't like there? He could get some skin resurfacing, such as like a CO2 laser. That might be a consideration for him down the road.
He was a tricky candidate, but as it turns out, things have gone really well. It's going to look great when he gets the ink out, because at the moment it's not where it should be because he has the micropigmentation little dots in the skin. So when they've gone and the redness settles, I think he's going to get a really lovely result.
The SMP pigment can be also removed with laser instead of just kind of letting it fade over time.
Month 3 after the repair, so I'm just here to see Charlotte in regards to the final SMP removal.
Hi Pierre, come in.
Hi,
How
Charlotte.
are you?
Yeah, good, you?
How's it looking?
Yeah, good.
You had some SMP work doing, which is scalp micropigmentation, which is tiny dots of pigment to disguise the look of a thinning hairline or bald head. With the hairline adjustments that he's having done, it's kind of sitting forward of that hairline.
Okay, so it looks like those little tiny FUE scars have healed nicely. You can see them, but they're not too obvious. And now he's having laser to remove the pigment. And then in the future, he can have laser to even resurface the skin for the scars.
The laser is going to work through the skin to break down the remaining molecules of pigment, and then they will naturally start to fade out over the course of the next few weeks. So we're just going to work our way back. You ready for this? Just working into the hairline slightly, just to soften it down so you don't have a hard line of where the pigment ends.
See, even what you described there's like lots of nuances to every craft, right? Including hair transplant surgery, including SMP, laser hair removal. So what I tell people is like you always want to choose someone who cares about all these nuances and looks to do their very best in whatever it is that they're doing. And I think that's a good way to go about choosing just about any type of service provider.
Throughout the entire process, it has been, what is the next stage? What is the next stage? You know, we're going to have another repair. I'm going to have to do the SMP removal. The hair has been involved in my life in some way, and that I'm pleased for that to kind of just be the end of it now.
Guy's been through a lot for sure. So overall, I think this was a nice option for the patient. I think it's important to bring up the fact that there will be scars there where the hair was removed. It's not scarless. You know, FUE surgery is not scarless. And normally those scars that we create for people with FUE are typically on the back of the head, as Dr. Ball was saying, but in this case, since it was corrective, hair was removed from right here at the front, in the corner there, right at the hairline. So just one other consideration to, of course, mention to patients when they're doing this type of corrective procedure. But what I saw was excellent technique, a nice clinic where all the general rules and principles of good hair transplant surgery were observed. TLC, if you're watching this, please reach out. We do some good work here, and we'd love to be featured on your shows and help continue to educate the masses. I know you liked this video, so please make sure to check out my reaction on Mike Malak's hair transplant surgery.